Point of View. I'm Destry Millsap along with Becky Pearson. And last week we talked about back pain in humans. And so we're going to follow that up by talking about back pain in horses. And we talked about a lot of different things. We talked about the pelvis, getting in a neutral position. We talked about leg length discrepancy. We talked about how the thoracic spine affects our low back and our movements there. And so now we're going to look at the horse. And with us, we have Kimberly Rasmussen. Again, Dr. Kim, welcome back. We're so excited to have you, and you're the perfect person to talk about horse back pain. I can't wait to hear what you have to say. So, Kim, when we talk about back pain in horses, what are some of the things that we want to look for to identify back pain in our horse?
One is going to be, if your horse is upset when you set the saddle on, there's the start, or you get on and you start riding and your horse feels stiff. You don't have bend in the body either way, and you can't get your horse to collect. So a stiff back, a drop back. So some of it we can just see by the horses, literally their posture. We think about our posture, like if we slouch or we stand up straight, or if we lean to one side, but our horses have that same posture, and they're born with good conformation without disorder. So as time goes on and, they do things, or they pull back, or, they do things getting started, or halter broke, or, run into each other in the pasture, like all these little things start happening. Muscle development, all that.
Yes. And we spend all of our time on their back. And so all of our movements affect their movements. And so in people, like if you get locked up in your thoracic spine, it can affect your low back. And then if you're locked up in your hip muscles, it can affect your low back as well. Can you talk about some of the mechanics and how that affects the horse?
Yeah, let me see if I can turn my camera and show you guys the skeleton here. But their spine also has a curve to it. Yeah, model skeleton here, and my little friend, the cat here. We're going to have a natural curve to the spine from the skull at the occiput to C3. We're going to have a flexion. 3, 4, we're going to be neutral. And then 4 through 13 here on the back, we're an extension. And then we go 13, 14 neutral, and then we go back to a flexion. So we have this curve like this in the spine. And if you get, one thing off, they have all this to compensate for. So if you want to say, here's, sacrum and pelvis back here, and your SI joint, it's deep right in here. You can see that. But say your horse, runs and, slips or kicks out or pushes out of the starting box or whatever, and the sacrum comes down, you're going to start to get a drop in the low back, like L6 is going to drop to follow the sacrum down. And then you're going to have a compensation here where these are going to start to lift up after that. And that's actually a decompensation, but then your horse can't lift his back. So if his posture here and his pelvis is with his butt out behind him, it's really hard to get him to lift the back. And that's something I'll even show owners, like on ourselves. If you've got your belly pushed out forward and your butt pushed out, try and flex your head and your chin down. It's really uncomfortable. But if you tuck your abs and tuck your butt, then you can make a lot of that come around. And when we ride, we want our horse to be able to carry us.
Yes. And so what are some of the common injuries that you typically see with back pain in horses? Where would they be at? If a horse has a mid back problem, a low back problem, what are some of the common things that you see there?
So I'll see a lot of, sometimes people will say their horse has a hunter's bump, or we've got big glute muscles here, and then we're lacking, middle biceps femoris here. And then they'll be maybe overdeveloped here, and we're lacking some of this top line muscle. Well, to me, that doesn't mean that the rider's riding the horse bad. To me, it means the horse isn't able to lift and rise. And interesting, one thing I find a lot of is, if you, scan down here and their back is sore, it's not always just the vertebrae. Sometimes it's these ribs. You can see how the rib cage is so connected. They have 18, and every rib. So let's see if I can make it where you guys can see it. There's thoracic vertebrae 18, and there's the 18th rib. And the 18th rib touches 17 and 16. So one rib, like I'll get on one rib and start to mobilize their rib, from here, you can't touch it there. So you work the rib from here and try to get that to mobilize. And you'll see all these back muscles spasm. So you can have a couple ribs causing, a lot of tension in that spine.
Absolutely. And you mentioned having core strength too, and that's super important in humans for keeping that stability in our spine is our core strength. So what are some first of all, we can't talk about horseback pain and not mention kissing spine. Let's talk about it. Everybody has it on their mind, kissing spine.
Yep. We go back here. So kissing spine is where, so this is the spinous process of the vertebrae here. These are the spinous processes. And then you have a little bit on the transverse. These are the long transverse on the lumbar. So where we have kissing spine trouble is going to be where these vertebrae touch. Now, if this skeleton wasn't fused, I could show you, like if we lift the rib cage, those are going to expand and get farther apart. I think I can maybe move it just a little bit, and you can do it a lot more on your live horse. But when you have a saddle that doesn't fit well, or a horse that's sore and can't lift its back, this drops down. And you can see there's a little natural shape to this one. And this horse is 2 years old. This is normal. Like, this isn't pathology from being ridden, but these start to touch. And that's the problem with kissing spine. But if we ride our horse correctly and have them mobilized correctly, we can keep a space there. So even when these are close, when you get on and ride your horse and they lift their back, that should come farther apart, not closer together. So like each vertebrae here, so where we got, let's say we're on 16, this vertebrae should move up and down, and it should move left and right. And it should also from the top move clockwise and counterclockwise. So we have a lot of motion there in that spine that if it gets restricted, they're going to restrict the next one and the next one, and we can start to exacerbate the problem.
Okay, so say that I suspect my horse might have a kissing spine issue. What are some of the signs I would look for? And then if I take him to the vet, what kind of imaging should I get? I mean, on x-ray, are there different angles of the x-ray that would show it better than others?
Yep, definitely. So when you take x-rays, or when I take x-rays, I'm going to mark the last rib here. I'm going to put a paper clip. I'm going to palpate the 18th rib, and then I'm going to put a paper clip there so that I can count. And I have a paper clip at 15, so I'll know which vertebrae are being affected when I do that, in case it is something that is painful and we need to, inject it with something to help give the horse some relief there. But you're going to notice that your horse is tense in his back, that he can't bend it. And x-ray is the best way. You do want to make sure when your vet takes the x-rays that it's a straight on view, and you're not taking the view, at an angle like this, they're going to look like they're touching. But if you're straight on with each vertebrae or each segment as you go down, it's going to be a lot different than at an angle. The other thing that's fun to do, and I think can be diagnostic, is just your horse here in neutral position. Take it again with the horse's head raised up, and then drop the horse's head and lift the belly and take it again there. Like, oh, can we create space there?
Okay. So I always wonder with kissing spine, how common is this injury? How common is kissing spine in horses? And is it overdiagnosed, underdiagnosed? What's your opinion on that?
I don't think it's overdiagnosed. I think we might be overtreating it. And then, going to surgery on horses that, aren't responding to injections. But I think if we would add in a little bit of, physical therapy, manual work, and, kind of key these riders in on their training to mobilize that, we can really avoid surgery a lot of times. I've seen some surgeries, and these horses that haven't been mobilized remodel and come back, and you kind of get those ugly edges coming back. But if you get the surgery done and you mobilize your horse and the vertebrae are all moving, we're a lot more successful. But I've found that most of the time we can manage this, because these horses weren't born that way. That's stuff that's happened from trauma or work or competition, just things that happen. And if we can help the body to heal itself, then we're not going to have to do invasive stuff like that. Not always, but a lot of times that's the goal.
I
I
agree, and we've talked before about having injections, but if you inject something and you don't address how that issue was caused, the mechanical effects of that, then you're not going to have the full effectiveness. It's not going to get all the way better. And so I really like what you said there about using treatment options, that getting them to activate their core, do specific movements to mobilize that vertebrae uh, back to where it's supposed to be. Becky, go ahead.
Yeah, I just wanted to say, the thing that I've been seeing in the horses up here in this neck of the woods is if they are diagnosed with kissing spine, like the surgeons, the vets, like there hasn't been any exercise prescription given to that owner to help engage the core, to educate them that if they can get the abdominal support there, like you said, you can lift that up and create some space there. And so there's not been a lot of education on what can we do physically to help these horses other than injections and surgery or the follow-up after surgery. I have a lot of people that said, well, this horse had kissing spine surgery. And then when I ask them, what kinds of things do they do to help maintain that at home? They're like, well, just ride them, and they maybe haven't went and had their saddle fit correctly. And I really think there's a big, huge piece of education that's missing on this, of how we can all work together to keep these back pain horses feeling better and working good. So I am not a certified saddle fitter, but it is something that we've done a video on our YouTube channel about saddle fitting. So I did have a Burns saddle rep. We did a video on that, and there is some really good common sense things that I think, if people set their saddle up there where it's supposed to be, where it has clearance around the shoulder blades, and you put your hand on your cantle and your hand on your horn, and you see how much rock there is front to back. You can also kind of see side to side, and you can make sure that there's clearance when you run your hand between the front of your saddle and those shoulder blades. And you want to do this without a pad. And so you get a true idea of how that saddle is fitting without the pad. I am not always one to jump into, hey, you need a different saddle. I do try some shims with people to see if we can relieve some pressure one way or the other. Some different padding options can kind of help a poor fitting saddle, but a really, really bad fit, obviously a pad isn't going to fix all of that. I'd be curious to hear your philosophy on that, Kim.
Yeah, no, I definitely agree with everything you said there. One thing I have noticed on some people, like they'll try when their saddle seems to, leave marks or they have uneven sweat marks, they'll go to a thicker pad and the horse is more unhappy. So yeah, that is one thing I've learned, that if you go to, an 1.5 inch pad and your saddle is already too tight, it's not giving the horse more protection. It's just making the horse's back bigger and the saddle fit tighter. So sometimes, if the saddle's fairly appropriate, you might try a thinner pad, just the same reason why, you're checking it, with no pad to see. But I like all that.
Awesome. Another thing that I think our listeners would like to know is, performance-wise, what do you think their horses might be doing performance-wise when they have this injury that might tip an owner off to, man, I think my horse might be getting sore in his back, or man, I think there's really something wrong. Like for barrels, for instance, whenever they're running barrels, are they, running up the fence? Are they having trouble bending and flexing? What are some of the common descriptions you get from owners on what their horse is doing when you find these injuries?
I would say, like, one horse I, manage, right now is, kind of sweetest horse in the world, do anything for his owner. And he's kind of top of the line guy. But when he gets sore, and we get by with him pretty well. And probably I have done injections on him twice in like 3 years to get him by. But what she'll notice is when she'll go in and go to turn that first barrel, he's almost like, I can't do it. Like the head comes up and he doesn't want to give and bend. Like he'll get it around it, but it's almost like it scares them when they go to engage that and it starts to touch. Like in that same horse, for example, we are always having her do belly lift. She's like, he's kicking at my hand when I do the belly lift. So what I have her do with him, and he's actually a lot better now with, time and, all the things, but I'll have owners, and anybody can do this. It'd actually be good for every horse that doesn't even have a problem, but just like, a stretch. It's almost like a full body stretch. Robert Miller's a vet, and he came up with this for horses that had to be stall rested, say for a couple weeks, and you didn't want them to lose, all their muscle tone while they're off. But he'll have you take, give them a treat at their head and ask them to drop their head down and go ahead and open that whole top line. So with the treat, it's motivation. They eat off the ground anyway, right? So drop their head. You've got the top line opened, and then bring that treat around to the side. So you've got flexion all through the spine, and then you start to get a side bend through the spine, and then you aim with that head to bring it down towards that hind ankle. And as you come down towards that hind ankle, you're lifting the rib cage on that side, you're closing, and you're stretching the back on the side, you're opening, and you're not specifically like, asking them to lift their back when they're like, nah, that hurts. But if there's a little food motivation, they can use their whole body for that stretch. That's great. And actually, if you do that with your horse every day, it'll take you about 2 weeks, and they'll be able to, not every horse, but most of them, our performance horses, will be able to reach that hind ankle with their mouth. So they'll stabilize and use their whole body, and they're going to have to lift, rotate, and side bend their spine and do it both ways. And that's going to help us a lot.
And would you do that before or after you get done riding them?
So one with the sore back or kissing spine, I would do it before you saddle, just to kind of get that horse to loosen up and wake those muscles up. And I would also do it after, like on any horse that sprints. So, any rope horse, any barrel horse, any horse, that jumps and, arches their back at the end of that jump when they kick their hind feet up to not miss the rail. Yeah. And the only other thing I guess I would say on that is, if you're at a barrel race and it's, 30 degrees and you want to stretch your horse, don't do it before you get on. I will get on, walk that horse around for 5 or 10 minutes, get some blood flow in there and get the muscles warmed up before you stretch them. Their muscles are really happy, like 40, 50 degrees. You can go ahead and stretch them before you get on. But if it's cold, you're not going to do a lot of good stretching those muscles till you get them warmed up a little bit. So I'd get on, warm them up a little, then stretch them, and then, get on and go make your performance or whatever.
Absolutely. I mean, we take those same principles to training our athletes and training ourselves. So it only makes sense to use those principles for training our horses. Becky, what type of performance things have you seen with horses with back pain? And then what kind of stretches, exercises do you give to people?
I'm really glad you brought up that stretch, Kim, of the going down and back to the side, because I think a lot of people, when they've been taught like the baited carrot stretches, is they've just been taught maybe just to go back towards the flank, but not down. And boy, that makes a big difference when you watch that horse's back. They really have to round, and you can see the spots of dysfunction. I mean, I even have a horse that he really can't elevate up in that thoracic part right behind his withers. He really gets stuck with that stretch. So that is a very good point. And those are very simple stretches, whether you want to use a little alfalfa or a treat or whatever, it is very important. And I'm probably just as bad as anybody about, I don't always take time to do that. But like, I looked at a horse earlier this week, and we got on the topic of possible sciatica in this horse. So the owner had said that she had a history of a pelvic injury, lots of SI, soreness. She basically would make one good run, like win the event, and then after that, she just would get sore and lots of issues. They ended up kind of retiring her. They bred her, and now she still has a lot of residual weakness, but she doesn't palpate a lot. My question for you, Kim, is like, how do you know you know, in a person, I can ask them if they have some numbness, tingling, and I can see weakness. Like this mare did have some obvious weakness, and all of her EPM titers are pretty low and within normal limits. How do we decide if that horse is having sciatica or nerve pain or weakness because of an old injury that has affected those nerves? Are there ways that you can diagnose that without an MRI, or kind of get an idea if that weakness might be due to nerve impingement up in the back somewhere?
Yeah, that's a really good question. So when let me see if I can switch again. Check like their sacrum. So if I'm behind this horse, I'll come down here and then I'll come across here, and they'll usually, be, sore and flinchy here. But sometimes I'll take a hand on the right side, on the left side, and start here and see, can they flatten their croup and can they flatten out their top line? Because you can imagine this is a little bit rounder in the real horse with muscle there, and see if they can come down here and can they tuck that pelvis without buckling in their stifles and their hocks. So I find the ones sometimes, we're injecting hocks and stifles all the time, and it buys them some time. And then we have the same problem happening again when this is stuck. There's one specific horse, you can ultrasound the SI joint. You got to have a bigger ultrasound than what I have and see. So that horse you're talking about, if that sacrum was stuck down and, the sciatic nerve runs underneath here, but if that's been stuck and that horse is fused and that can't be mobilized, you might see some of that remodeling on an ultrasound. It's a little trickier of an ultrasound, but yeah, it's not really an area we can get to with MRI, but bone scan, you could see if that lit up there. But that's kind of an exercise, the owner could do, after the horse is adjusted, and just ask the horse to flatten and then ask them to tuck. Like if you squirt them with the water hose and they tuck their butt, that's kind of what you want them to do. But you don't want to do it fast. You want to do it slow to retrain that muscle memory that, yes, this horse can move the sacrum here and he can stand on his stifle and he can stand on his hock and he doesn't need to tip his toe off the ground. So I think that's a way to do it slowly, kind of like physical therapy, to reteach them that you don't have to flex your legs to tuck your butt, and that's going to help them a lot.
That's a great point. The other thing that I think is really hard, like when I see horses, I actually looked at another horse, same person, had a history of stifle issues, and the stifles seemed to palpate great, but man, was he sore up on like the points, the wings of his pelvis and up in his back muscles. He was so tight. And so, differentiating of, has this horse compensated from these sore stifles, and so he's twisting his back to avoid bending the stifles and the hocks, or is it kind of a chicken and the egg thing? The stifles make the back worse and then the back makes the stifles worse, and so we did a lot of soft tissue work on that horse, and he was very locked up in his pelvis. And so my hope was that as we got his stifles were feeling better, now let's work on working through that residual stiffness that he ended up getting in his back. And so we did a lot of soft tissue work on him the other day, and some butt tucks, myofascial along that top line. And then she did have an appointment for her other horse at the vet that can do chiropractic. So she was going to see if he could do some chiropractic after all that soft tissue work. So hopefully we can make some progress on that. And, are the ulcer points up in there too? Like if they're ulcery, will they show some back pain issues and like referred pain from hock and stifle? Do you find that some of that gets a little confusing?
Stomach points, the ones that work for me, depending on the acupuncturist or the place you study, like some will say there's some points here behind the girth. To me, I didn't learn that those are actual acupuncture points there, but when you start to tighten that and it pushes your diaphragm, is up under here, under the rib cage, inside of there, and the stomach sit, the liver and then the stomach sit right behind there. So you're going to be changing a little pressure on that. So I think that's why when we girth up an ulcery horse, they're a little offended. But the stomach points I like the best are going to be right here below the TMJ. I'll go about an inch down, and I'll have a hand on each side and stroke, and that horse, they'll flick their head away from you like that. And I'll check their teeth. If it's a tooth issue, the TMJ is going to be sore, so you kind of rule that out. And then my other stomach point is down here, down the brachiocephalicus, about a hand's width in front of the shoulder and a hand's width off the bottom, and I'll stroke the bottom. So stomach 6 and stomach 11 are the ones that I use for that. But it's interesting you say that, because stomach 36 is right on the stifle.
Oh.
Yeah. And that one maybe can be used as a diagnostic point. It's not one that I use, so it wouldn't be my specialty on that point.
Okay. Yeah, because I've had different, different input from different vets as to, they say, oh, well, that soreness there is from ulcers. And so it's
yeah, it can be so many things, right? Because, sore back can be, those 2 vertebrae, or it could be the rib, or it could be the diaphragm, or it could be a back muscle sometimes, or, the psoas that goes under the pelvis. So I feel like it's just so interconnected.
Yeah. One other question that I had this week was, so I gave this horse that had the weakness in the hind end, I gave her an exercise prescription, and her question was, how soon should she notice a change in strength if just strengthening this mare now would be helpful? And I told her I thought 4 to 6 weeks, just going off of athletic training, and Destry, you can probably give us some input on this too. Like, I really feel like within a month and a half, she should notice a considerable difference if we aren't still having some nerve impingement. What are your guys' thoughts on that?
Well,
I'll go.
Kim, go ahead.
I would say, like, when I was trained with my original training in the osteopathy, I'm going to go right along with what you said, Becky. Like, you mobilize this horse's whole body and say it's a fit horse. You're going to be engaging muscles that weren't being engaged before because they were seized up on the other side. So it's going to take your horse 2 weeks, a fit horse, 2 weeks to adapt to those changes. Go ahead and keep riding. That just helps them. And then they're going to build on it for another 2 weeks. So I'm saying right around a month.
Mm-hmm.
Just right. Yep, that sounds good. What muscles would you be strengthening specifically? Like, if they're locked up in their hips, what muscles would you be releasing? And then to get them to drive up under themselves and increase their core strength and hip strength, what muscles are we looking at there for the horse?
All the pelvic muscles back here. So say this horse was locked up pelvis and sacrum, or we had this ilium up and in, and we had the sacrum down and it couldn't move. You're going to be overdeveloped in your glutes here. You're going to be underdeveloped in your biceps femoris. You're going to be underdeveloped in your tensor fasciae latae. Quads will be underdeveloped here too. And then you'll be overdeveloped back here in the hamstring. So I think as you get your horse to move correctly, like, ground poles are great. Like, if someone, isn't like a, big time, trainer, just get your horse to move right. Ground poles is a great way. You don't even really have to think about it, but they're going to have to lift and engage their quads, and they're going to have to lift the stifle up, and they're going to have to lift through this SI joint and get the rest of these muscles moving together and working correctly. I also think lateral work is great. Like, keep your horse's body in, a straight line, like the head to tail straight, and move them diagonally, like make them cross over underneath themselves, or do a circle, not disengaging the hind end, but do a circle where the body is in an arc and that inside hind is stepping forward and underneath the sternum without disengaging. That's going to get you to engage psoas muscle, lumbars, abs, and everything as well. So a little dressage in there for you.
Oh yeah, absolutely. All the disciplines. What kind of like sets and reps would you have for that?
I would, when the horse is weak, if you can get him to do 2 steps correct, let him walk out of that and take a break, and then, come back in, and maybe next time you can get 3 or 4 and let him walk out of that, and just make sure you reward, every little time they try, because where those muscles are weak, it's hard for them, and they won't be able to hold it right away, but I think you'll make, huge bounds in a couple weeks on as far as their mobility. And then another couple weeks, you'll really be starting to build some tone.
Becky, what are some drills that people can do in their warm up for barrels or roping or something like that that will help encourage pelvic neutral, keeping the pelvis neutral, and build core strength as you do your warm up?
Yeah, that's a great question. So I like the idea of doing some of those stretches even before you ever saddle, to get that spine moving, get a little more flexibility. A lot of times, and I do it more probably thinking of getting their mind engaged, doing some lateral flexions. First thing you do when you get on, flex your horse to the side, make sure they get soft before you give them that release. The other side, you go ahead and walk off and do a one rein stop. Again, you're getting their mind engaged. You're also working on spinal flexibility. Then you can go and just do walking circles. And I just plant my hand on my thigh and just kind of keep gently squeezing them forward. Again, you're working on your lateral flexion with some forward motion. And then, like Kim said, you can work on them getting that inside hind foot to step up underneath themselves. And what does a barrel horse need to do? They need to step up underneath themselves. So you can do all that stuff at a walk while you're working on getting their joint fluids moving better. I love the 2-track like Kim was talking about. I don't usually do that at a warm-up at an event, but I do that in my daily riding in the arena, where your horse is, let's say, headed straight towards the end of the arena. His body's pointed straight to the end of the arena, but his body is moving diagonally forward towards that opposite corner, if that makes sense. And it takes a little bit. There are not a lot of, your horse has to be pretty broke to do that, but I think those are good goals as a rider. When you aren't specifically working on drills for your discipline, I really feel like we should be working on getting our horses more broke, which helps them with the longevity of their career. So they're going to work better. They're going to be more sound if we can keep them soft, supple when we're riding, getting them every time you stop, backing up a few steps so we get their hind end engaged. And we want to get more of their body weight shifted to the back, because they want to be probably at least 60, if not close to 70% of their body weight on their front end. And so to me, that's kind of a poor design. So we have to help them engage that huge hindquarter and get more of their weight shifted off of their front end to the back end, which also helps build their back end. So anytime you stop, you should really back up a few steps and kind of pivot to move out of that. That reinforces that hind end engagement. So those are all things that I do, and things that if somebody comes and rides with me, or we go to a clinic or do a clinic, those are things we talk about in the clinic to get people just using those kinds of things while they ride, and using their time when they're riding to the best of their benefit.
I think that's great with the backing. I'll even, sometimes after I work on a horse that's had, certain disorders, I'll have the owner just in hand halter and lead rope work on the backing. And I'll say, I want them to back up straight. If they were stuck in that right SI, I don't want them to back away from that right SI. I want them to back up straight. So we'll just do halter and lead rope on flat ground. Let's get them to back up straight. And that's goal number 1. And then I want them to back up in diagonal pairs. I don't want 1, 2, 3, 4 back. I want diagonal pairs. And sometimes they'll be draggy with the front end, which kind of ties into all what you were just saying. So then you just, take your foot and just tap, go real slow. I want a pair, and just tap the slow front foot, and like this foot, and then it'll back up, the left front with the right hind, and then let that horse pause and process that, and then tap the right front, and then ask them to back and get that right front to move back with that left hind, and diagonal pairs. And then once they're pretty, it doesn't take long for that. Like you can fix that in one session. And then I want them to back up, level without their head in the air when their back dropped. I want their head, level where their back can relax, and they're pulling with that hind end instead of pushing with the front. And when they're doing that correctly, they'll pick up the front feet when they're not heavy on the front and pulling with the back. And when I get my clients good at that, I'm like, okay, start backing up hills. And when they're good at that, I'm like, all right, get on and, back them up in circles. Like we can just keep on and keep on challenging these horses. And like you said, they're going to last us longer, and they're going to stay more sound the stronger we get them, especially in their core muscles.
Yep, absolutely.
Awesome. Kim, I want to talk about one thing. We kind of touched on it just a little bit when we were talking about the ulcer points. Kidneys, livers, things like that. We've addressed the orthopedic, all the stuff that we could see orthopedically. We're still not getting better. What have you seen with like a kidney issue or a liver issue, or even you mentioned diaphragm stuff, and how do you identify that, and how do you treat that as well?
Ugh. That's a tough question. No, that's really good though. These horses that, we're hauling all the time, and we're driving through, Dallas, Fort Worth, they're inhaling all that exhaust from all that traffic. Like that's all stuff like the lymphatics are going to have to filter out, the kidneys and livers are going to filter out. So we do need to keep our horses as clean as possible. Like lymphatic drainage is something that can be done on them, especially on the liver. Visceral work, like along with the osteopathy, we're stuck, at a particular place in the vertebrae. We're like, okay, we're innervating, the liver here. Let's see if we need to, lift on this or do that. There's ligament attachments of the liver to the diaphragm. So when we get all this rib cage moving and get the sternum moving and get, thoracic 17, 18 moving, then we're starting to work on the diaphragm. We literally, get our hands on that from the outside and take some strain off it that way. So blood flow, just having this, good body work done is going to help them some. Kidneys, we got to watch diet on these horses. There's some of these feeds that are going to be really high in, the heavy minerals like, magnesium, manganese, calcium, phosphorus. You want to make sure you're on a good feed that's got those in the right balance. Your kidney's going to be filtering all that out. Or if we're feeding them too much protein, like we'll see horses in the summertime on, 14% feed and alfalfa, and they're like drinking a ton and they're just body sore, and then they don't want to eat, but it's not ulcers. Like they have to drink more water to flush that protein out that they don't need. They do need some, I'm not saying that, but if we're giving them too much, and then when it's hot, alfalfa actually creates heat when they're digesting it. So they're not going to crave that when it's really hot, because they're going to get hotter and it's more protein. They're going to have to drink more. So those are just little signs we can watch. And, so our diet, does somewhat need to change with the horse's workload and what they're doing and what we got to think their kidneys are having to filter through. If you see them urinate, like, if it's a gelding, you want to see them, usually drop their penis out and not be peeing through their sheath. That should be a relaxed stance and not a tense stance. They shouldn't be, urinating in their sheath. You'll see some tight muscles, at the back of the saddle. Make sure your saddle's not hitting them hard, right over the kidneys, and that's going to make them tense in their back. The urine should be clear. I mean, it can be yellow, but it should be clear. Like you should be able to read the newspaper through it if you had it in a test tube. If you're seeing cloudy urine or syrupy urine, get a hold of your vet. Do we need to do blood work? Do we need to check this urine? Do we need to change the diet? Check and see if things like that are going on.
I'm really glad that you brought up the diet part of it, because I have had friends that have had kidney issues in their horses that, maybe they were on that 14% pellet or too much alfalfa or whatever it was, and they'd be sore, but the way they would present is they would buck, you just never knew when it was going to happen on it. And a lot of the time we see it with horses that were like hoppy in their hind end, or they throw hop when they take a hit or something like that. I mean, I've seen those horses have kidney issues, and you work on all the back stuff and then it still doesn't get it, and then all of a sudden you do lymphatic drainage on their kidney, you get them on a kidney supplement that helps those kidneys function better, and all of a sudden they don't buck anymore out of nowhere. It's crazy. And we have a mare who was labeled as an outlaw growing up, and no telling what had happened to her. We've found that she had jaw pain, she had ulcers. She's, here's an interesting thing. So, and this was a long, like when we first got this mare, I got her from my sister, and I took this mare, and she's a freak athlete. She was a really good mare, really broke, but man, you didn't know what day it was going to be. She was going to try to slam you, and she just had a horrible reputation. And so I started roping on this mare, and she was coming along really well. Well, then one day she takes a big hit from an 800-pound yearling, and just never really was the same after that. And every time the rope would crack on there, man, she would just bury her head and it was on. And you just couldn't, she just wouldn't, you couldn't rope on her at all. And I'm like, man, well, she had this reputation. She was an outlaw, and just couldn't figure it out, Well, then, a while down the road, we take her, and we addressed ulcers in her. We had her TMJ injected further on down the road as we learned more about that. And then we take her and get her TMJ injected. And I'm telling him about, my wife makes a joke about, well, you're not gonna be able to rope on her anyway, because she doesn't like roping. And the vet goes, well, let me just go ahead and shore this up. And so we take her in, and he shoots an x-ray of her back, and she did have remodeling of the bone where those vertebrae had an injury at one time. So it turns out it wasn't any type of thing that she either liked or didn't like roping or something like that. She had that injury, and anytime she would take that impact, those vertebrae would come together and it pinch her really hard. And then, that was her reaction to get away from it. And I've seen other horses, especially in rope horses, and, as the young ones come along, or maybe it's just a horse that just took a hard hit, whether it was a big cow in the pasture, or they took a hard hit from a big steer and we're trying to pull a big steer or something, and they take that hit every time and they get a back injury. And now when they take that hit, they're bucking, they're hogging around, they're running off, trying to get away from it. They're running through your hand, not wanting to sit down in the corner. Those types of things that we've seen when horses have back pain and they don't want to get a hold of those cattle. So I'm really glad you mentioned all that. There's a lot of different things that a person needs to think about and pay attention to in their horse whenever they're not acting right or seem to have a training issue or something like that. Man, we talked about it. Look at your saddle fit. Maybe your saddle's pinching them somewhere on their back. Maybe there's something that you do, a movement that you do that is unstable on their back, which is why we have our rider performance trying to shore that issue up. And then, maybe they have an injury. Maybe they took a hit and they need, maybe they're twisted up somewhere in their spine and their pelvis, and they need chiro work, they need muscle work, something like that. Just always pay attention to that and try to be an advocate for your horse and get them to somebody that can help them, and don't just think that it's a training issue and that's them that day.
I like what you said, and I've seen this a couple of times, so I just want to make this point. Like, so say your horse takes a bad hit and they, have a big catch, and you're like, oh shoot, is my horse okay? Well, it seems fine walking out, and 2 days later it seems fine. So you go ahead and keep riding this horse for 2 weeks, and you kind of forget about that because the horse didn't start bucking afterwards. And then 2 weeks later, you start to have a problem, and you think the horse is just doing it out of the blue. Well, at first they can compensate for, what they had. But once those compensations start to get sore, then you're going to start to see an outwardly problem. So sometimes you got to think back, it did happen then, even though, my horse didn't start, all the refusals or whatever immediately, because they do try to compensate and do us right for a time, I think.
Yeah. And I had a young horse that, man, he was coming along really good. And young horses, they all go through that box sweat where they're going to be a little bit hotter in the box when you start asking them for more and stuff like that. Well, man, one day he was just terrible in the box. I mean, just real ratty, real ramped up. And we've been pushing a little harder and stuff and running some harder running cattle. And so I wasn't sure if it was that or whatever. But then I get to feeling on him, and man, he was just really sore in his back and hips and stuff like that. And those young developing horses, it's so important to keep them in a good alignment and build strength the right way. So I ended up getting him worked on. And the very next time I roped on him, he stood there, didn't move a muscle, ran, did his job, run back. I mean, we probably run 5 steers that day. And every day since that, he just went in there, stood, and went and did his job. No funny business, no moving side to side, just scored like a rock. And he's 4 years old, and he was a special horse anyway. But what I mean is even box issues, gait issues. I'm sure, Becky, you've seen horses that have come to you with gait issues, and Kim, you too, that have had some sort of issue in their pelvis or back, that they know that, man, when I get going in there, they just expect that hit. They just know it's going to hurt. And that's where some of those issues can come from. And so making sure that your horse is getting some maintenance there, and you're doing exercises to build that, is just so important.
Yeah, they can't talk to us, but that's how they're talking to us. You know, they can't verbally say, hey, I hurt here. And we have to be smart enough to try to figure out what they're trying to tell us. And they are telling us. We just have to we have to listen and get some good people on our team to help us figure it out.
Absolutely. And we've talked about sciatica, we talked about it in people, now in horses. We also talked about leg length discrepancy, and going back to what you said about how the pelvis affects the hocks and stifles. Is it chicken or the egg? Does the hock affect the stifle? Does the stifle affect the hock? Do both affect the back? Does the back affect them? All that type of thing. Kim, what have you seen with a horse having? How do you identify a leg length deal? First of all, could they have one leg that seems longer than the other in the back because of pelvic rotation?
Yeah, I think they could. Like if you're watching them walk from behind, it'll look like they're taller on one side. And to me, a lot of times I think they're overdeveloped on one side and underdeveloped on the other side. So say, the sacrum's not lifting up on the right side, they're gonna be just the hair bit flatter over the croup on that side. You mobilize that and you see them in a month and they're nice and even again. Front legs, I would say sometimes we'll look and be like, oh man, that right knee's higher than the left knee. And then you start looking at the feet and the heel angle, and you'll see that. So, maybe it exists more than we're appreciating in horses. I definitely have heard a lot more on people on that. But what you were saying, does this affect the hock? Does this affect the stifle? I think SI pain pelvis sacrum is going to be those horses that end up getting the whorl bone injections because their hips sore if their pelvis is off, because the femur comes out of the pelvis. So if this isn't sitting right, this pelvis here, this way or in or out or forward or back, where this rotates in and out of there isn't going to be quite right. So that's why those horses respond to those whorl bone or acupuncture injections there for pain. But if you can get the pelvis moving and even, there's a joint there at the pubic symphysis that can have a strain on it, which is going to cause a strain on the hip. Or then you look at the stifle here, there's your femur, there's your patella, there's your tibia. And if you look at your, tibia, then it's connected to the hock. So say this horse is running and takes a turn, or the ground gives and the hock turns in and the stifle turns out, and we rotate here at the hip. Like you could have a lot of, I lost you. You could have, rotation and say the tibia, and rotating in that tibia, you can see, there's hock, there's stifle. So yeah, I definitely think it all goes together. So you don't want to treat one part without treating the other. And we try to treat, what's primary, but sometimes only the horse knows that. So we treat it all and just double check and make sure we got it.
I agree. And that is so important, to stay consistent with the person that's treating your horse, so they can see that development of, okay, we've treated the hock and the stifle, the back, okay, what's next? And maybe we should have treated the thoracic spine. Or you mentioned the feet, so we haven't really talked about that. And last week we talked about foot position and how it can affect your hips as well. So you know, like if you don't have enough support on one foot versus the other, if you need a lift in one side versus the other. So talk about how important it is to have those feet correct. What kind of angles the foot should be at to better support the pelvis, and what those ideal angles should look like.
So if you're looking like you want your horse to have some, angle to the stifle and you want some angle to the hop. And if you're looking at the feet, like if this was a live horse and you've got coronet band here, you want to see if this horse is standing square. If you followed the line of that coronet band, you're going to hit elbow or below. You don't want them so long in the toe and low at the heel that your cornet band angle is like this. And if you follow that line, you're going to be hitting them in the belly. So you don't want them to have too much torque on their stifles. So that's a common thing I see. Well, it's not real common, but if you see a horse that's kind of got that bull nose growth at the toe, like that horse is hitting too hard, too much weight on the toe because it's too long, and that hoof wall is going to start to have an arc like this. That'll be a good horse to go ahead and shoot x-rays so your farrier can see how much toe length there is, how much sole depth there is, and see if we can correct those angles with the trim, or if we need to, wedge them or get some frog support. But yeah, having bad angles is going to affect the way you use the whole hind leg. Like horses dragging their toe, like squaring off their hind toe is another thing. Like, oh, let's check and see if those stifles are sore and they're not wanting to flex, and that's why they're dragging that toe. But those would be the biggest things I see on the hind end. This is when they start developing muscle in their back, they're going to develop it, in their loin first. Everyone, complains they don't have top muscle here. When they start using their hind end correctly, you're going to start to get this nice loin muscle here. And then as they advance, you're going to get muscle here. And then right behind the withers is the last place to start filling out as they start, lifting and coming up in their back. So, on the young horses, you don't want to go spend $6,000 or $4,000 on a new saddle on a horse that is still maturing and developing and going to change. But I always tell people that, right behind the shoulder blade as they mature and get stronger is the last part of their back to fill out.
Yeah, that's a very important piece of information there, especially with all the futurity colts and stuff like that going on in the barrel and horse world, reining, cutting, all of those things. That's very important to pay attention to as those babies grow up, among other things.
Yeah. Right. And I always tell people, like, when you see this question online a lot, like, how do I build top line on my horse? How do I build top line on my horse? And what do I need to feed for it? And I think, I said to somebody the other day, I said, well, one way to build top line is to actually strengthen the bottom line. I think, like, get their abs going and they won't be nearly as sway backed. I mean, if you can get them support underneath, that'll help that top line, along with nutrition and things like that. But I always think it's interesting to look at the comments of what people think they need to do to build that top line.
Absolutely. All right. Well, any closing thoughts on that? No, ma'am. I'm getting some no's there. Awesome. All right. Well, I will close it out. Dr. Kim, thank you so much for coming on and showing us your model and sharing your knowledge with us and your time. Thank you so much. Always a pleasure to have you on here. And if anybody needs to get a hold of Kim, you can get her number from us online and get that scheduled. Becky as well. She can help you with the horseback pain stuff. Both very knowledgeable in that. So thank you everyone for listening. And as always, let your health be the pivot point to your success.